Welcome to Deuk Spine Institute. It is July 11, 2024. I'm Dr. Deuk Majan, CEO and founder. Our patient comes to us from Las Vegas, Reno, Nevada. He has an interesting history, but he's had back surgery and fusion with metal 26 years ago. Now he has adjacent segment disease below the thoracic fusion. He has 3 discs, L3, 4, 5, 5, 1, that are causing him horrible pain in his back, and we're going to fix that today. He also has a piriformis muscle tear in his left buttock with horrible piriformis pain. We're going to fix that as well, but that's a separate procedure. Now, you're welcome to watch and ask questions as we go along. A little bit of numbing medicine. But the first step in these surgeries is placing our needles into the discs that need to be treated. So that's the first thing we're going to do. And I'm already hitting something metal or something hard. Okay, good. So we got a pseudo disc. Oh, by the way, he did have an infection too. Not here with us, but after his surgery, his spine surgery, and he had an infection, apparently with MRSA. As you know, MRSA is a horrible bacteria, methicillin-resistant Staph aureus, aka flesh-eating bacteria, and he had to have a debridement of that. So all that related to prior issues, nothing current, nothing today. Shot? All right, today we're going to go in and fix the L3, 4, 4, 5, 5, 1 disc. Shot? We got to get around this hunk of metal. Shot? All right. Is he awake? AP? Mm-hmm. That's fine. That's fine. You do what you need to do. Keep him safe. Let's go, AP. Pull towards you as you're rotating. Shot. Oh, nice. Got lucky. All right. You can see that the metal is not right where we're operating, even though it's overlaid on the lateral view. If you have questions, feel free to ask us. I can't see the needle. The needle. You had it, and it's gone now. Shot. I need to see the tip of the needle. The tip of the needle. It's probably off on orbit and wag. There it is. Perfect. So you're going to keep him asleep? Uh-huh. It's fine. Yeah. Yeah, I'm in the disc. Perfect. All right, I'm going to make an incision.
So you had a very bad jet ski accident.
Jet ski? I didn't know that. Oh. Wow. I mean, to have this horrible problems from a jet ski accident. Oh my God.
And he broke his pelvis too.
Oh my gosh. He broke his pelvis too. All right, num. If you have questions, feel free to ask. Henry, take over.
Yes, sir. At this moment, no current questions, but in the meantime, we would like to show a animation of how why
You got to go more north there.
why do discs cause so much back pain. And so we want to show our latest animation for that.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals.
Okay, so you can see from our video that discs do cause pain. They cause pain through a process called inflammation, which actually is a natural response of your body to injury. Any kind of an injury, your body responds through inflammation. Let's get an AP. You can see the hardware on the lateral view. You guys see the metal screws
we do.
and everything, and then we're going to go to a front view, and you're not going to see it because it's not in the spine. It's actually off to the side. That's perfect. Okay, and that's important because it gives you a better understanding of how x-rays work, right? Something that you see on one view may not be present on another view. All right, we got one more needle to place and we're going to be ready to get the show on the road. Shot. This last needle goes to L3-4. Now, this patient and I had a nice talk, Shot, before surgery. He was, trying to just do the bare minimum of what needed to be done. And I explained to him, listen, if we don't get all of these discs treated, you're still going to have pain. And that's one thing that I have to have a conversation with a lot of our patients is these discs cause pain. And, you may be able to fix one, but you're still going to have pain in the other ones that we're not fixing. So let's get it all done. Let's get it all done. And he just needed to know that I agreed that they all needed to be done. All right, we've accessed all 3 discs through one little cut, 7 millimeters. Now we're going to go and fix them all. But before we do that, I want to do a discogram where I inject some dye. He's not going to be reliable, right? Shot. Shot. And she hot. Perfect. Shot. Oh, shot. Why? Let's do the higher ones first. I dropped a Raytech on the floor. No, let's not do 5-1. Let's do 3-4 first. We're going to start with L3-4. Normally, we'll have our patient awake during the discogram so we can figure out if the disc is indeed painful for them. But unfortunately, with he has a very low tolerance to the anesthetic being off, and he starts to squirm around quite a bit.
And he mentioned that too,
Yeah. So we can't have him moving around. We tried it before you guys came on. He was like thrashing around trying to get off the table. So that's a safety issue, and we cannot have our patients thrashing around. So we had to make him a little sleepier so we can do the surgery. Shot, Monica, come on. Interesting. Are you ready, doctor?
I think I am.
He had a really bad jet ski accident. We were talking about it earlier, and had to have his whole spine fixed and pelvis fixed.
There should be a lot of scar tissue.
Oh, there is. I'm encountering a lot of scar tissue. A lot. I can feel it. Wait. Yeah. Huh?
Give me 1 second.
Shot? I know it looks horrible as hammering this thing in, but that's how you get into the disc. Henry, let's show our audience the 30 causes of back pain, so they can be aware that there's more than one cause to back pain. And whoops, look at that. So there's so much pressure inside this disc, it's literally pushed my God, my dilator is just getting pushed out. You guys see that?
Yes, we do.
It's actually going in and then it's coming out like a bullet. Shot? Watch this. Boom. See that? Watch the dilator pop out. Boom.
Yes. Yeah,
On
we
its
saw
own.
that. Yeah.
Incredible. So that's because there's so much inflammation in this disc. that it's literally under tremendous pressure pushing, the herniation is pushing my tube out. So I'm glad we fixed this one.
In the meantime, we shall proceed playing the animation of how the Deuk laser disc repair works.
Have we done the 30 causes yet?
Not yet. We have not done that yet.
Yeah, why don't you do that?
Oh, we could do that?
Or,
Yeah.
or whatever, you know, choose.
Yeah. Copy
All
that.
right, there's the tear we're here to fix. And we'll just get to work while you guys watch the educational animation.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, you can see from our video that the procedure we're doing is called the Deuk laser disc repair because we're repairing a damaged disc that's painful. And what's painful is this right here. It's called the annular tear. And what makes it painful is the herniation, the blue stuff right there. The blue stuff should not be there. That is the herniated, degenerated nucleus pulposus or disc herniation. It's sticking inside the annulus and it's putting pressure on the annulus, which is extremely pain sensitive. There are little nerve fibers in here that normally are not found in the annulus. They are far more than there should be, and they're there because of the chronic inflammation, which is caused by the herniation. So the disc becomes pain sensitized and it becomes very painful. And just little things like injecting a little liquid in the disc will set off the pain for the patient. Any kind of pressure of the disc will set off the pain.
I think him being on his stomach is really hard for him.
Really?
Yeah, just body positioning
Huh.
is triggering.
So
Big trigger.
when we were putting this tube in his disc, he was really uncomfortable, and that's why we had to make him sleepier. Otherwise, he was moving around. And I don't mean he's awake uncomfortable, he's asleep uncomfortable, but think about it. When you're asleep, if somebody were to grab your toe with a set of pliers and squeeze on your toe, you don't have to be awake to move. Your body's going to move on its own. It's going to move away from the pliers. You're going to reflexively, subconsciously try to get away. All right? That's just something we're all born with, is that reflex or subconscious behavior where we move our bodies away from pain sources. You have a question, Henry?
Yes, we have a question coming from George on YouTube.
All right, we'll take George's question and then let's get into the 30 most common
Yes.
causes of chronic back pain.
Exactly. Next, the question coming from George asking, "Hello, doctor. This is George. I have a question. Why does my herniated disc on my neck cause headaches and numbness on my arms?"
Thanks, George. Great question. So the reason your herniated disc in your neck causes headaches is because behind the disc is a covering that's white. And we saw it during the last surgery. As a matter of fact, if you go back and watch, you can see it. That covering is called the dura, D-U-R-A. Look it up, D-U-R-A. Go ahead and write it, Henry. The
Copy that.
dura is found from wrapping around your spinal cord like a sausage casing, and it runs from your tailbone up to the top of your head. So it wraps around your spinal cord and your brain. It also wraps around the nerve roots coming off the spinal cord. Well, the dura is a thick white protective layer. It stands in Latin for dura, means tough, and the full name is dura mater, tough mother. Mater is mother. And what it is a protective layer around your brain and your spinal cord to protect it from infection. Okay? So it's been there for millions and millions of years, if you believe that. And the thing about the dura is that it has nerve fibers in it. So it's pain sensitive. And when you get a herniated disc, well, guess what? The herniated disc gets on the dura and causes inflammation. We talked about that in the last surgery. And that inflammation can travel from your neck all the way up to your head, causing headaches. The name of the headache is called cervicogenic headache. Spell it for them, Henry. Cervico, C-E-R-V-I-C-O-G-E-N-I-C. It stands for genesis, which is to create. Cervicogenic means to create from the cervical region, which is your neck. Cervicogenic headaches. It means headaches coming from your neck. And it's well known that headaches can come from herniated discs. As a matter of fact, when we published our original Deuk laser disc repair paper, we reported that 92% of headache went away with the Deuk laser disc repair, our surgery that we did. So it's well known that these headaches come from the neck and that they come from the herniated disc. Now, arm symptoms, remember I said that the dura covering not only goes up around the brain to cause headaches when it's irritated, but also it goes down the nerve roots to the arms, and it causes arm symptoms because it irritates the nerve roots, right? And what's in your nerve root? You have the dorsal root ganglion, which is the sensory nerve bundle of cell bodies sitting there in the neural foramen right behind the disc. Of course, the disc herniation irritates the dura and the dorsal root ganglion, which causes arm symptoms. So that's why. If we fix your herniated disc with this particular surgery, it should get rid of your arm symptoms, should get rid of your headaches, and you will be a happy man. Come to Deuk Spine, George. All right, we got a bunch of scar tissue here. This is an old injury. You don't get scar tissue overnight. This takes years to form. So this clearly has been here for a long time. Now, these herniations can be there for 10, 20, 30, 40, 50 years. We've had patients with herniations for 50 years. The longer your herniation's there, the more degenerated the disc becomes. Did we do the 30 causes?
Not yet. No.
Let's do that next.
Of course.
I'm Dr. R. Deuk Machen with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Machen. Thanks for joining us. Welcome back. So, you now have a better idea that there are really 30 major causes of back pain. Now, they don't all cause pain the equal frequency. It's not a 1-to-1 ratio. The most common cause of back pain is the disc. You could see the disc, specifically the L4-5, is by far the most common. The L3-S1 is the second most common, and then the L3-4 is the third most common cause of back pain. This patient has back pain coming from L3-4, L4-5, L5-S1. Another common cause of back pain is the piriformis muscle. We're done here. We fixed one disc. We're going to move on to the next. So he has 3 discs and he has one piriformis muscle causing his back pain. We're going to fix the piriformis after we fix the disc. This is a little antiseptic here called betadine, and we use betadine to clean out the surgical wound when we're finished, because we want to minimize the risk that somebody would get an infection, so we use that on every patient. We do everything here with sterile technique, like real spine surgery should be done, but even though you do your best, sometimes an infection can happen. We've not had an infection. We don't want an infection. So we do everything we can to prevent it. Come on in, come on in. The kind of things we do: sterile prep and drape, alcohol prep, DuraPrep, Ioband, sterile drapes, Obviously sterile equipment. And antibiotics, IV shot. And of course, antibiotic irrigation, which we just did. And then we do a sterile closure and a sterile bandage. So, shot, we take a lot of precaution during our surgery to reduce the chance of any kind of introducing any kind of a microorganism into the patient. And this patient, of all people, understands the value of precautions. He's been through a horrible infection after his surgery, not with us, but with, in the past. And we certainly don't want him to have another problem like that. Take your time. All right, we're going to wait a second, put pressure. So we're going to, make sure he's comfortable, and then we'll proceed. Any questions?
Yes, we have a question coming from George once more on YouTube.
George, sure, George. I'll take your question.
Asking, how do you know that you debrided the tear since you entered the disc blind? You using CARM, you don't see the disc with the camera before you enter.
So how do I know the grade of the tear?
How do you know that you debrided the tear since you entered the disc blind? You using CARM, you don't see the disc with the camera before you enter.
Well, George, great question. I think I understand your question. But we know we debride the disc because I'm going into the disc tear, not the disc, but the tear, all the way to the bottom of the tear. And then I start to debride the tear. As I debride, I go back out with the tube. So we are seeing the tear from the inside out, if that makes sense. But we're seeing the entire tear, and I can see with the endoscope that I'm debriding the entire tear. Hopefully that makes sense.
They wanted to reiterate, saying not using CARM, they meant to say C-arm. You're using C-arm, you don't see the disc with the camera before you enter.
Yeah, well, we use the endoscope, George. I can see with the endoscope. So, George, let me show you. Can you see this, Henry?
Yes, we can.
Let's pretend that this is the outside of the tear, and this is the inside of the tear, and this is the annulus. All right? We put the tube all the way to the bottom. There. You see that?
Yes.
And then I use the laser to clean as I pull the tube, the scope and the tube out. So we're cleaning the entire tear from inside out, exactly from that, inside out. So we do see the tear. We see it arthroscopically. Okay? For example, at the beginning here, we're at the bottom of the tear. And then as I clean, I'm going to pull the tube out. We're going to move to the outside of the tear. There's a piece of herniation. You guys want to see it? Show it.
Yes, sir.
Can you see this?
Yes. Yes, we can.
All right. There's a tape measure. Luis will show you. That's a good 2 centimeters long piece of herniation. Any other questions?
At this moment, no current questions. So in the meantime, let's show the audience of what is a microdiscectomy and why you should avoid it at all costs since we have this surgery right here.
I agree with you. Microdiscectomy, bad surgery. All right, welcome back. You can see that with a microdiscectomy procedure, which we don't recommend or perform at Deuk Spine because it's an old, antiquated treatment that is invasive, painful, unnecessary, and it doesn't really do anything. Microdiscectomy was done originally because it was really the best treatment we had for a herniated disc that was pinching a nerve, causing weakness in the leg. And microdiscectomy's been done for 70 years now and by surgeons, spine surgeons. And the problem is, to do a microdiscectomy, you have to destroy parts of the spine to fix other parts. So the part you're destroying, you're taking the muscles off the spine. You saw that. You're taking bone out of the spine, normal bone that shouldn't be taken out. You're taking out, oh, look at that, folks. There it is. We talk about the inflammation all the time in the tear. We found some. Look at the color. This is absolutely gorgeous. This is what we want to see. That's where all of his pain is coming from. This pockets of inflammation. We're going to zap it away. Inside that is where the nerves are that hurt so bad. As I was saying, with microdiscectomy, you take away bone, you take away ligaments, you take away the joint, the facet joint, you take away the muscle, and it's a big incision, it's very painful, creates lots of scar tissue. So there's no reason to have a microdiscectomy to fix your leg pain or pinch nerve when you can do it with the Deuk laser disc repair. And we don't take any bone, ligaments, muscle, or joint away. You doing okay over there? All right. So George, you see how I pulled the tube back as I debrided? I'm going and cleaning around the edge of the tube, and then I finish and I pull the tube back. George, where do you live?
I will give that answer once he responds.
I wonder what George does.
As do I. In the meantime, let's show the video of how a laminectomy is performed and why a patient should avoid that at all costs.
Yeah. We're showing you guys these videos of surgery procedures that are done that we're not recommending you to get, but we want you to see what they look like so you know. Because your surgeon, the surgeon that you go see that recommends the laminectomy is never going to show you the laminectomy videos because they don't want you to see them because they're very invasive and very painful surgeries that are highly destructive. But the reason these surgeons recommend them is they know that by doing a laminectomy, you're going to need more surgery. So you'll come back to them to get your fusion. So they're basically doing the laminectomy to set you up to get a fusion. Okay? Well, isn't laminectomy a doozy? Who wants a laminectomy? Raise your hand. Laminectomy is an invasive surgery, bloody, removing bones, ligaments from your spine. By the way, the bones and ligaments taken out of your spine should not be taken out of your spine. They're only taken out because it's such a bad treatment. You understand what I'm saying? For some reason, whenever I think of laminectomy, I think of Hiroshima. You know? Massive destruction, totally unnecessary, could have been fixed a different way, far less invasive.
Yeah, thank you.
Just something we all regret in history. I get it, the Japanese were out of control, they needed to be stopped, but so many lives lost, 100,000 people instantly died, civilians, women, children. It was just a big black mark on history. And there was a way to go back and do something different. You know, I don't know, I wasn't there, but I can tell you right now, there is a way to do things different today. You don't have to have laminectomy. Laminectomy is bad. Okay? Maybe back then, Hiroshima, you know, Fat Man was necessary. Was the Fat Man Hiroshima? So there were two bombs dropped, Nagasaki and Hiroshima. One was the Fat Man and one was Little Boy. I don't remember which one Little Boy was dropped on. Henry, maybe you can answer that.
Yes, Little Boy was Hiroshima, and then Fat Man was Nagasaki.
All right, there you go. Either way, they're both bad, and they both killed hundreds of thousands of people. And the point is, thank God we don't have to do that anymore to get things done in war. Maybe it'll be worse now. But with back surgery, you don't need to do laminectomy. You don't need to do microdiscectomy. These are destructive procedures. There's tremendous collateral damage. Patients suffer. They take painkillers for a long time. And the damage is permanent. It never, never, never goes back to being normal. Never. We're going into the last one, doctor. Are we okay to proceed? And I'll wait for you, okay? Now we have the Deuk laser disc repair, okay? Just wait. Yeah, Deuk laser disc repair, this procedure, we don't take bone out, we don't take ligament out, we don't destroy muscles, we don't destroy the normal spine. And we get in there and get the job done like a ninja. Shot? Who likes ninjas?
I do.
Samurais don't like ninjas, but we all like ninjas. Who thinks Ninja Turtles was the stupidest idea ever? Huh? You like the Ninja Turtles?
I do too. They're awesome.
I'm sorry, but
That's like jumbo shrimp.
I know.
I just have a soft spot for Michelangelo. He's a funny guy.
Yeah, well, Michelangelo is funny,
Yes.
but the whole idea of a Ninja Turtle.
Oh yeah,
is
yeah.
just-
The concept is ridiculous. Yes.
I think that's it. This disc is extremely tight. Very collapsed, very scarred up. 5-1.
No current questions, but we do have a comment from George when asking where he's from. He replied back, Europe.
Yes. Thanks, George. We knew you were spying on us. From Europe. Right. We narrowed it down to the continent of Europe. Good. We're coming for you, George. We're coming for you. Okay, you can see tiny cut, 7 millimeters. We're going to fix 3 discs. If I had done a fusion on this patient, which would be the alternative, his incision would be this big. And there would be as you saw with the laminectomy video, a lot of bleeding and bone missing out of the spine. Screws, rods. Yeah, infection. Don't say the I word. Okay, any other questions? Because we're almost finished with this surgery. We've got a few minutes left.
No current questions. So in the meantime, as we did play all of our animations, let's re-show what it is exactly that we're doing and how the Deuk laser disc repair heals the annular tear.
I love it, Henry. Great suggestion.
Of course.
Thank you.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4 inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
And welcome back. So you can see what we're doing with the laser. We're cleaning the tear. This is L3-S1. This is the bottom disc. It's the worst one. It's the most degenerated. It's been damaged the longest, had the most inflammation. And I just want you to look at this thing. Okay, the laser fiber is the same. It's a millimeter. But look at all that orange. That is calcium, scar tissue and calcium. And there's just a lot of it because there's been a lot of inflammation here. I think he injured this disc first. This looks to me to be at least 20 years old. Could be 30 years old, 40 years old, but something 20 and older, okay? And to George's question earlier, how do you debride if you're not using the fluoro machine? We are moving backwards through the tear, debriding it using the laser.
We have a question.
By the way, before we take the question,
Yes.
we're going to end this broadcast in about a minute, and we're going to move on and do the piriformis release. The piriformis muscle is torn and extremely painful for this patient from Las Vegas area, Nevada, Reno. And he doesn't want to go home with a pain in the ass. He wants to get it fixed. So we're going to release his piriformis here at Deuk Spine. It'll take us about 10 minutes to do. So we're going to end this broadcast. We're going to restart with the piriformis release. All right, we'll take the question.
Question coming from Lanu on YouTube,
Thanks, Lanu.
asking, just curious, how heavy is the laser you are holding?
The laser fiber I'm holding is very light. It's probably about an ounce. I don't even know if that's right. An ounce, maybe? It's very light. But the laser machine is 350 pounds. Huge. Heavy. Big and heavy. All right. You couldn't pick it up. You need 3 people to pick that thing up. It rolls around on wheels. All right, we're done. By the way, there's the tear. And look at that. It's about 1.5 millimeters wide. That's going to heal quickly. Okay, we're done with the Deuk laser disc repair. We'll be back with our piriformis release. Let's end.
Copy that.